Welcome back, friends. So when do you actually know depression is just the blues or it is actually a condition that you have? Well, we're going to break it down, and we're joined today by Dr. Petersen from Holtorf Medical Group. How are you?
Great.
Thanks for joining us, and I think it's something that we need to really talk about as well. You know, what's the difference between a bad day and depression?
You know, the DSM-4 criteria, which is still the official, they haven't accepted the new one yet, but the official criteria for depression, you have to meet 5 of 9 symptoms, and we all in medical school memorize these symptoms: change in your sleep, change in your interest, a decrease in interests, feelings of guilt and worthlessness, lower energy, poor concentration, feeling sad, suicidality. Well, those things have to go on for only 2 weeks. Well, I could feel 5 of 9 symptoms after the death of a loved one, right? So that's a good question, and it's a hard question for patients and doctors to answer. I think that it's important to realize that depression is a real thing. It's a thing that needs to be treated, and it's a thing that is not the fault of the patient to have depression. And that's sort of what we assume. We take on this complex of, oh, I should be able to overcome this on my own. And that's sort of silly.
You know, there are some days that I think, oh gosh, I'm feeling a bit low and a bit blue, we've had a tough day at the office, and we throw around the word, I'm so depressed.
Well, and that's because the medical community co-opted the word. The word depression existed before we ever came up with the diagnosis. And I think that's a disservice to people, because we can feel depressed for a day or two. That's actually good. The fact that your mood can change up and down means you're not depressed.
Thanks, Nish.
You can feel down that day because, you know, just not that, it's not the day for you.
Make you feel good all the time. No bad days here at the Dish. But, so how do you know then if it's serious? Is it because it lasts more than 1 or 2 days?
Well, I think it's really when it's affecting your quality of life.
Okay,
and
like what?
If you can't do the things you're supposed to do for your job or for your family or in your relationships, and it's ongoing to the point that you say, this has altered who I feel like I am. We can all feel sad for a little while, and that's okay. We should be emotionally educated. I was listening to a piece on NPR on the way here, and I thought, that's interesting. I like that, emotional education, to understand that. That's okay for us to have emotions and say, oh, I feel sad today. But when it's altered my life, and now I can't perform the functions of what I do well, I should probably see a physician.
Well, we know, you know, of course, after someone passes away or something like that, you can feel very depressed. What are some other things that can be a bit of a sign that things aren't working? What are some key signs apart from just feeling a bit blue?
Right. You know, one of the things that you mentioned was when someone passes, any stress, and it doesn't have to just be a bad thing, any stress will alter the way that our body works. And so the passing of a loved one or getting a promotion and then the stress of having to do this new job, either one of those can alter the amount of thyroid, oxytocin, adrenals, all of these things, serotonin, they can all shift around.
Okay.
See,
so then we can have these symptoms.
It's life changes.
Right.
Any big change, I think you have to adjust.
Knee surgery could cause these changes. So I think your question was, what symptoms should we look for?
Yeah.
You know, those things that I mentioned are the official criteria for depression, but what's frustrating is that they are also the same criteria for low thyroid, adrenal fatigue, heavy metal toxicity, diabetes, sleep apnea, obesity. You'll have this crossover for all of those things, and what happens is you go in and you see the doctor and you say, I have these symptoms. And instead of saying, well, let's diagnose you with some appropriate blood work, let's do a physical, we sort of, because it's easy, say, oh, well, you have depression, here's some Lexapro.
Thank you. They're not doing a proper analysis of across the board.
Well, so how do you make sure your doctor diagnoses you correctly? How do you know if that's happening? What questions do you ask?
That's a good question. I think you need to make sure that some lab tests were drawn. And it's hard for a patient to know which ones should be drawn and how many should be drawn. I have patients that come in all the time and say, I had all my lab tests, here they are. And it's 3 pages of stuff, and I think that's not really all we can test for. Another thing that's important, and maybe I'm jumping ahead to this, is that if you've been treated for depression and the treatment hasn't worked, in 2006 there was a report called the STARD report where they did a retrospective study of changing things, and then a prospective study on top of that of what do we do if the treatment doesn't work. Changing your antidepressant will almost never help you.
Oh.
If being on the antidepressant didn't work, then what we need to do is say, we must have been wrong. And thyroid, T3, works far better than changing the antidepressant.
But I think that's actually
serotonin.
what's done most commonly, right?
Absolutely.
You just go from medicine
Exactly.
to
That's
medicine.
exactly what I was telling
Try
medical school.
holistic. Try holistic as well.
You bet.
Try all options. Make sure your doctor is open to all facets of medicine.
Right.
I think you need the right doctor, and that's what you will get at Holtorf Medical Group. If you want to talk to Dr. Petersen about this, we're going to put his information on our screen and also online, located in Utah County there, but go to abc4.com/dailydish. That's the website, so you know now when you get to the right one. Dr. Petersen, thank you.
Thank
for
you,
being
guys.
here.
Great information again, but hey, sticking around.
Daily
Daily
Beauty
Beauty.
and Viral Video when we
Up
come
next.
back.